Ladies and gentlemen, I'm so happy that we have such distinguished panelists with us. Eugene, who is really an expert in medical care in the city, and really the entire system, right? And Larry, with his global reach and experience of different cities, he can tell us, where we stand, truly stand, right? Okay. So maybe I'll start with Eugene. Dr. Eugene, as a change maker in transforming healthcare in Singapore, what do you think is the most innovative pivot in planning for medical care in Singapore that has seen significant success, and in what way?
Well, Chee, thank you very much for the very kind introduction, and also thank you, Lawrence, for this kind invite. I sat here this whole day very amazed by the diversity in the room that we have today. And let me let you in on a secret, right? We have talked from the morning about food and agriculture, and we have talked about families and religion. Let me tell you that you guys have more to do with health than healthcare, all right? I like to think of us as just a repair shop. And the work that you do out there really contributes to the health of our population. And with that, really, I think one of the greatest pivots that we have seen has been the recent white paper that the government has written on moving towards a healthier Singapore. The last time a white paper was written in healthcare was 30 years ago, where we first established, the 3 M's framework here in Singapore, which is the MediSave personal savings account, as well as the setup of the public health system in Singapore, with 80% of provision provided by hospitals and 20% of primary care provided by the public sector. Well, that is pivoting, because I think the most important thing now for us is to consider the fact that we should really go beyond healthcare to health, and that the sickness care model that we have in many of our countries is just not sustainable. So I think, therefore, we are taking very baby steps to make that possible. But as I take those baby steps with many of my colleagues, we then realize how inadequate we are in healthcare in terms of how we can set about transforming health. So really the challenge now to all of us is to work with everyone out here to be able to look at the upstream social determinants. How do you look at aging well in place? How do you think about keeping the patients out of the hospital rather than keeping them in the hospital? So I'm really looking forward to this discussion as well, Chee.
Thank you so much, Eugene. Well, as I understand, Eugene was also one of the team of visionaries who created the NCID, so that Singapore was ready when COVID hit us. So, but I realized that he's not emphasizing on just hospitalization. He's emphasizing on overall health, which is fantastic. So with that, Eugene, what is the biggest obstacle towards holistic medical care? And since you talked about us this morning, right, can we as citizens of the city play a part in it?
Most certainly. I think we need to shift the power base for health away from hospitals back into the communities where our residents live. And that has been really the redesign of our entire health system. And this redesign has to happen at many layers. At the care level, we need to go beyond what we call a volume-based care model, which all we do is to service all of the patients that come to our doorstep, right? To a more proactive care model in which we are able to go out there to keep our residents well and healthy. And so what we have done is to now emplace a lot of our community health teams integrated with active aging centers in each and every one of our neighborhoods. The journey has just started. We are kind of halfway there, but we are already starting to see that that offers a lot more traction in terms of keeping, especially our seniors well and aging well in the community. we need to also then shift beyond the care level to look at stronger health and social integration. Because we realize that even as a developed country, where perhaps you could say many of the social determinants here are well catered for, from housing to sanitation, and the economy is growing, right? But with an aging populations, there are new social drivers to health. For example, we see seniors living with disability. We see seniors living with dementia, seniors living alone. And these are social issues that a medical model will fail terribly at addressing. So how do we go upstream to look at social care in a way that we can work very closely with our communities and very much with our residents to keep them well? Last but not least, at the next level, so if you go from the care level to the system level, the next level is the ecosystem level. So we well know that the impact on the environment has huge impacts on health. You talked about NCID. One of the biggest challenges we have is with the environment, right? With, this rising temperatures and this very humid weather that we are getting, vector-borne diseases are one of the biggest struggles we have here in Singapore, right? Every year, a few people die from dengue here, which is something that can be entirely avoidable. And so when we start thinking about how healthcare should be a good citizen of the environment, but we should also understand better the environment's impact on the health of our residents. And I think that is where a lot of the change is going to happen in terms of how we can make healthcare more sustainable as we go forward as well.
Fantastic, Eugene. I think it's deep insight there. So not only do we shape the buildings, but we shape nature, because we want nature to not bite back at us, literally, right? So now it basically syncs very well with what I'm going to ask Larry. Okay. Again, the interesting thing about me asking Larry is that Singapore organizes the Lee Kuan Yew Prize. So shouldn't we be giving the prize to ourselves since we receive so much praise, right? So I have to kind of rack my mind to make sure that I really understand what Larry sees in the city, okay, globally, that we can really learn from. So as a change maker, Larry, in transforming how we can identify and value abilities and potentials in cities, what made you and your judging panel recognize the 2016 Lee Kuan Yew World City Prize laureate Medellin? What can Singapore learn from a city in a developing country?
Well, it's a very good question, but I need to provide a little bit of background so that you can understand better. But first, let me thank Lawrence and Chee for inviting me back to this Shaping the World Summit panel discussion. I remember a couple of years ago, I was one of the speakers on this topic. So the next thing I need to is to thank URA for giving me such an honor to develop the Lee Kuan Yew World City Prize in 2009 so that we can remember our late founding father, Mr. Lee Kuan Yew, through this name after him on these prizes. It's like a Nobel Prize. At that time, the very first one was a water prize. It was awarded for what Singapore is really good at. So after the water prize, which debuted in 2008, next one was the World City Prize. So when I was asked to develop, I was just wondering, what's this all about and how can we do it? But it was such an honor because to do something that can contribute to our late founding father's name perpetually. So in 2009, we developed the prize. 2010, the first prize, the first inaugural award was given to the city of Bilbao. And you probably know about the Bilbao effect, right? So Bilbao was, everyone, when we gave to Bilbao, they were surprised. Bilbao is such a small city. Why is it that they got it? But there are few things that the prize look at. The 4 tenets of the prize will be livability, sustainability, vibrancy, and a high quality of life, urban life. That's very important. So, and also when we look at cities, we don't just look at city as per what they are at the moment as it is. We look at the transformation process at least over 10 years, all right? I need to explain this so that Medellin come in. So after Bilbao, it was New York, no surprise. It was Suzhou, no surprise. The biggest surprise came in 2016 when we awarded to the city of Medellin in Latin America, Colombia. Why was it? Can I have the slides on?
Yes.
Oh, yeah. Okay, good. If you look at this, this is Medellin. You don't see a lot of high-rise like in Singapore, right? But you look, the picture representative of Medellin is actually, I think in Spanish they call it favelas. It's actually the commune, the informal housing up in the mountain. Right, next. So in 2016, we awarded to Medellin for what? For its success in overcoming the challenges of uncontrolled urban expansion, years of violence due to social inequality, and of course for its remarkable transformation over the past 2 decades. From the murder city, Medellin was known as the murder city in the 80s, 90s, to a model for urban governance. Of course, these come about a lot through many, many shocks. So you can see that the before and after, just a typical example on the slides that you can see. There are many issues, many criteria that we look at. I myself was shocked, surprised at Medellin, that the transformation, how they have transformed. Can you imagine it's not so easy to transform from a murder city to a model for transformation, especially when one of the governor was assassinated, all right? And the Botero sculpture was kind of partially destroyed. So there's a lot of story involved in it. But they have bold leadership. They have long-term plans, and they have social innovations. And the city leaders tackle all these and improve the economy as well as the citizens' employability. Next, please. I just want to highlight a couple of things. The important thing they did was connecting people to opportunities. If you can see that, that is a metro cable. They had a lot of social innovation. The metro cable is the first in the world that used for mass transit of the people in the mountains, the favelas, to the city centers so that they can given the opportunity to be employed, right? Why is it they were known as the murder capital in the world? Because it is up in the mountain. When you don't have all this infrastructure, by the time you walk up to your home up in the mountain, you'll be raped, you'll be mugged, and you'll be murdered. And that's how, because of drugs-related issues, they were known as the murder capital of the world. So with this, it was very fast for them to bring them up to the home. The other aspect is that they have a lot of long-term plans, and also they did a lot of urban innovation. If you look at the picture itself, they have the water tank. So at night, you see all the dark spots. So they use the water tank and convert them like our community club. A place for the children so that they got place to play, place for education, and a lot other issues. So these otherwise will be not so gainfully engaged. Next. You look at this, there is no limit for the extensions. These informal housing just continue, and one day it will reach the peak of the mountain. So what they did was, they actually had this circumvent garden, and they stop it so that they cannot go any further. And for the informal housing, what they did was they don't evict them. They actually legalize them so that you can't, social innovation is very important. You can't evict all these people who are up in the mountain, they are the masses. So if you evict them, where do they go to? They can't go anywhere, right? Only those houses that are structurally unsound, they will relocate them accordingly. So with this, they have the whole circumvent garden up in the roof, and they did a few things. First, they trained them to be gardener on urban farming. They trained them on construction. They built a library. It was donated by Spain called the Spanish Library. And they created a lot of these events so that all these children can help in managing their own home. They also have hundreds of escalators. For those who want to go up, not through cable, they use escalators. All these escalators that are disused from the mall, from other places, will be used for them to use up to their informal housing. This way, they have a nice route, and they actually train the people that live there to be leaders, to be surveillance. So for this, they actually have dropped a lot of murders, a lot of these issues, and they have, from that, next, governance is one of the most important, and public-private partnership is equally important. So in Medellin, one of the things they do to facilitate the urban social innovation is to partner with some of the government statutory board. EPM is just like our PUB equivalent, and the PUB equivalents donate 30% of the profit every year for social intervention. And not only that, they provide infrastructure for all these indigenous housing up in the north. And the RUTA is the one that do all the research work. And for local government, 5% of their budget is allowable for the community to decide what they want to do. So for example, some of the community decided that after school children can be trained to be future leaders. So they have events and leaders for that. So I was very surprised that through all this, Medellin was finally named the prize laureate in 2016. But the thing is that you look at Medellin, it was very surprising because they are one of the initially underdeveloped city, now developing and still developing. But you'll be surprised that all these cities are given a chance to be shown to the world. And Bilbao and Medellin are two most dedicated laureate cities that continue to be part of the Lee Kuan Yew World City Prize laureates councils in that sense.
Fantastic, Larry. Wow, so you guys have an instant idea, how to, with not necessarily a lot of money or opportunities, how to be really innovative, how to pivot as we speak, right? And build on local talent and ideas. So really, I would like to kind of combine both Larry and Eugene together, because there was this very recent documentary about the blue zones. And Singapore was identified as a blue zone, right? Okay. But again, it's quite interesting. In this case, it's very different because a blue zone is considered a place where there's a high percentage of long-living people, people living above 100, right? And the examples, right? The first 5 examples were basically very, I would say, rural, sometimes very slow, like Okinawa, Japan, Sardinia, Italy, And interestingly, for the last documentary, they mentioned Singapore. Everybody is like, wow, right? Okay, yeah, we are certainly not Sardinia, right? Or Okinawa. So what is it, to my 2 panelists, what is it that Singapore excels in? And also what might be missing in our little red dot blue zone?
Well, when I first heard it, I almost turned blue.
Blue, you know.
But it was amazing to be recognized. That documentary is on Netflix. It's called Live to 100. And was filmed with, on the research of Dan Buettner, where he traveled the world looking for places where people were living long, right? And one thing to understand, the whole mechanism of that in those neighborhoods and in those zones that he found. So let me take one step back before I kind of give my thoughts on some of the blue zone accolades that we have received. When I first joined the National Healthcare Group as a medical officer, then the group was just being founded. So Singapore was reorganizing its health system into clusters where we could integrate care better between primary care, hospital care, and community care. So the National Healthcare Group was formed in 2000,